Good morning, bonjour à tous. On va faire la transition en anglais maintenant, so just preparing everybody to get their headsets on as I'll be.
Donc je vais parler en français, en anglais, pardon. Donc juste pour vous donner le temps de prendre des écouteurs éventuellement. Donc comme mon nom est Tigest TAMRAT et je travaille donc dans le département de la santé reproductive et au sein de l'OMS. Et je travaille également avec des collègues que vous connaissez peut-être, Garrick Mel, et cela fait déjà un certain nombre d'années maintenant que nous mettons au point un certain nombre de ressources dans le domaine de la santé digitale, numérique, donc ce qu'on appelle la e-health. Et nous avons également fait beaucoup de recherches dans ce domaine. Certaines des ressources dont nous pourrions parler, qui sont des ressources que nous avons mis à la disposition de certains de nos partenaires.
Resources that we'd like to flag that would be perhaps very useful for the community of implementers here today. One of them is the MAPS toolkit, which is the mHealth Assessment and Planning for Scale toolkit. And we'll be speaking a little bit about that in this presentation. There's a copy in French, which hasn't been fully disseminated yet, but I can give you a sneak preview of it. Currently, there are copies in English that exist in the hallway. The other resource that I'll be speaking about is about monitoring and evaluating digital health interventions. So as we know, actually being able to see the effects of the digital health interventions is very important, not only for scale up, but just making sure that it is doing as intended and is actually resulting in effects for improving the lives of women and children and mothers. And lastly, I'll be speaking a little bit about the Digital Health Atlas. So the MAPS toolkit, the mHealth Assessment and Planning for Scale toolkit, it's something that we were able to tap into the collective knowledge of implementers around the world. There are a few of you in the audience actually that have helped to inform this. And it has two goals. One is to be able to assess your maturity or how far you've scaled up. I think scale is one of the themes that we keep hearing about today, and in the past 5 years it's come up quite a bit. How do we transition from pilots to something that's a fully scaled and sustainable implementation? So what we tried to do is we tried to learn from the best, from implementers that were on this path, and we tried to create different axes or chapters, as we call them. And within this, you have different necessary components that will influence your scale up. So one of them is your groundwork, making sure you have a vision for where you want to scale. Is it just one district, one country? Is this regional? What exactly are your parameters of scale? And what is the environment that you're planning to scale up in? Is there enough infrastructure? Is there electricity? So these are key components and questions that one must reflect on along this pathway in trying to scale and have a mature implementation. Partnerships, I think we all know, is very critical. No one can really do anything alone. So do you have the mobile network operators? Do you have government? Do you have researchers? Do you have implementers? There's a quite variety of people, and I think in digital health especially, it's where there's an intersection of a lot of different types of partners, not just clinical partners. And then financial health. So how have you been thinking about how you're going to sustain your implementation beyond maybe when you have the initial donor funding? Are you planning to share some of the costs with another organization? Is there going to be a partner that can help absorb some of those costs? And while I think this is a very hard topic to tackle, it just asks questions about how you're planning to do this, because for any type of scaled implementation, this is a critical component. For digital health or anything that requires technology, there's a lot of questions that we ask about interoperability. So, are you using standards which is going to allow you to interoperate with what exists within the country? Is it going to be adaptable? Can you change it to multiple languages? Can it change from being on a tablet to a smartphone? So these are questions, and they're all measured. They have points so that you can actually assess yourself and see, okay, I need to do a little bit more work on this area, and I'm doing really great on another area. Operations, I think this goes without saying. Do you have the appropriate training, materials, outreach? Do you have contingencies for when electricity shuts off? Do you have backups if your data isn't going through? And just making sure that implementers are thinking about these questions. And lastly, something that's very dear to us at WHO is monitoring and evaluation. Is this actually resulting in any effects that's improving anybody's lives? So these are the 6 different axes, and you could read about them in a little bit more detail. It results in a type of scorecard where there are specific questions, and implementers can ask themselves, or external agencies can ask implementers of how they're doing. And no one will probably get a perfect score, but at least it leads you in the right direction of what you should be thinking about. So after creating this tool, which exists on paper, a lot of people were starting to fill it out, and implementers were very interested in actually having a digital version that they can complete so that you're not adding up the scores on a paper sheet. And because this is digital, we naturally decided to take it into a digital platform, which is called the Digital Health Atlas, which is live and about. I think you guys may be one of the first ones to see it in its newest forms, and I'll share the link very soon. So it allows you to do the assessment using the WHO MAPS toolkit. So you can actually click right there, you can come back to it and see how you're performing 6 months later. One thing, though, that we actually decided to add to it so that it would be useful for governments as well is to have an inventory or mapping of all the digital health implementations. I think we often come into this situation where governments would like to know all the different implementations that are existing in their country, what district, what exactly are they doing. Implementers themselves would like to also know who else is around so that I can partner with them, or that you don't replicate exactly what's already existing within the country. So within the Digital Health Atlas, beyond it just being a digital form of the MAPS toolkit, we also have added a mechanism where projects can register themselves and track their implementation. And then lastly, and this is something that we're working on, we're trying to have it as a link to resources and implementation experiences that people can write on, so that it's actually a community where people can learn from experiences. So this is all now available at digitalhealthatlas.org. We urge you to sign up, check it out. We're really open to getting any feedback about it right now. Lastly, the one thing the monitoring and evaluation, we also have a resource on it. It has not yet been translated to French, but I think it's an important resource for when we actually ask ourselves, is this really doing anything? And one of the things that it's separated across 6 different chapters, which you can all go through and read the book, so I won't put it in this presentation. But
ce qui est important, c'est de voir comment nous pouvons dissocier 2 approches dans l'évaluation.
you have to do internally to the system. So is it sending out text messages as planned? Are people receiving those text messages? Is your data hitting the server? Those things are part of the monitoring. And if those don't actually happen, then you can't really see any effects on evaluation. And we've seen a lot of programs where they forget the monitoring side and they say, okay, 2 years later, we don't see any effect. Well, it wasn't really being monitored effectively. So that's one thing that we stress. And then just to end on the last note, the focus of M&E monitoring and evaluation should actually vary across the implementation maturity, across scale up. So initially you may want to focus on functionality, stability. Is the system doing what it's supposed to do? Is it crashing on you? And those may be the preoccupations in a very early stage. But as you go in further, you'd like to know questions about, is it being implemented well? Is it cost effective? Is it effective? Is it being able to be scaled up? Is it integrated? So we just like to also highlight that there are different questions that need to be asked. And all of these can be found in the document here. This is just an explanation of what this may look like across, from functionality to integration and scale up, what the different things that you should be looking for. So I will stop here. More of the resources are available, and you can read a lot more about it. I'm also available all of today in case anyone has questions. If you do have any questions or you'd like to email, this is my colleagues who is responsible for this entire portfolio that you can contact. Thank you, everyone.